Okay, Ray. So what I'd like to ask you first is kind of what effect did prehab have on your sort of treatment journey, and what did you get out of it?
A lot. And I feel quite evangelical about prehab. And I told the doctor who set it up a few years ago how sort of supportive I was. And when it was first suggested I come along here, I thought, oh goodness me, it's going to be sort of geriatric aerobics or something. And I'm really not in the mood for that. But of course it wasn't. And what was fascinating was the introductory session where they just basically see what I can do. I thought I was more fitter than in fact I was, because I was a bit active and a lot of walking and other exercise, but I thought I was fitter than I was. And that introductory session reminded me that in fact I'm getting old. And then all those months later, after coming here for some weeks and then to the place in Carlton, and then having the follow-up measurements taken, I suddenly realised that I had made real progress. And discovered, as I said at the time, discovered sort of muscles and muscle groupings that had long dormant, that I'd forgotten that existed. Because one of the things that happens when you get old is that you gradually lose all sorts of functions, including balance, but muscle tone and other things. And that the work that I did here and at the Carlton Centre was so focused that it was without a doubt beneficial. And I went into hospital on the Monday and I came out on the Friday. Whether that was because I've been through rehab, I don't know. But the combination of prehab and then since last June 24, going to rehab at the Portland Centre, I think as an elderly man, I'm in a far, far better place than I would be, would otherwise have been, and certainly in a better place than many of my contemporaries who simply don't do as much exercise or monitor their progress of exercise as much as I do.
Mm-hmm. Excellent. And what did you like the most about prehab?
What did I like the most about it? I like being active, and I've always been sort of mad about exercise, and despite all sorts of having 2 new knees and a new hip and all sorts of stuff, I won't go into my medical history. It was just nice being focused on my body and what my body could and couldn't do, and accepting that the various things that I've lost the use of over the years, and being able to sort of think, well, that needs attention. And I enjoyed also, of course, particularly when going to the Carlton Centre, I enjoyed the company of the other people, and I got to know some of them really, really well.